Hello, how are you? How are you all feeling? Today I'm very happy. We have someone very special today in our studio and whom I met just before pandemic, post-pandemic, the first phase. And then and since then, I've been working with him together, and not only me, but a whole lot of us from Kolkata, Kochi's, ICF Kolkata, all of them, we are working very closely. This is none other than Dr. Ravi Kannan, Padma Shri, as well as Magsaysay Awardee, and it is really, I'm so happy that you could make it today, Doctor.
Thank
in our
you.
Studio. He has done tremendous work in Northeast India for cancer patients. He's director of Cachar Cancer Hospital. So I'll not, I know, he's been telling, okay, Sharmi, keep it short. So I'll not, you will know more about him as we speak. So once again, thank you so much, Doctor, for being here.
Thank you for inviting me.
Thanks. So today it's like, we've been working since 2020, I think.
Yeah.
We are working since 2020. It was in the middle of that pandemic thing. Just when there was a break, I think we went with a group of people to visit Cachar. And I just loved the hospitality. And I don't know what was there. There was a magic in the hospital, which made us go every now and then just have conversations and speak about it. I still remember one of the online sessions because then there were restrictions happening, and I was doing this with nurses, and they were going through so much of emotional trauma because of the things which was happening around the hospitals, which they were able to control and not control as well. And so many memories are flooding in, Doctor. I'm just wondering, where do we start? And I have, I've asked for some questions from a few of my friends, and we have loads of questions also. But I will just ask an open question to you. What will be, what do you want to say to anyone who is a human being out there?
I think there is enormous goodness around us, plenty of it, and if all of us join hands, we can change the face of the earth. For a moment, if we put aside our personal likes, dislikes, prejudices, our personal agenda out, and we just focus on looking at the community around us. We just look at our own community. We don't have to look at a global community. Just look at our own communities. Together, if we all work, we can change the whole world. That is the power of human being.
Powerful. Wow, that's so powerful. This as like whatever. So what I understand is around you there is so much goodness. So look at the goodness and then connect hands or get together, and you can change the world. And this is so powerful at this time when there are wars happening. There are so much of I think so much of cancer happening, actually. I mean, every alternate people I meet, someone on the air, I mean, I'm using the word cancer as not only the cancer as an ailment, but so much of illness happening as well. So in order to stay well, you said that, you said that you have to start. So where is it that we should start?
See, cancer is a lifestyle disease.
Lifestyle disease?
Yes. So India and many parts of the world are transitioning from underdeveloped to developing to developed economies. Mm-hmm. And along with the changing economic dynamics, the health and disease and wellness patterns are also changing. So all underdeveloped and developing economies see a predominance of infectious diseases because of water, because of food, because of whole lot of reasons. But as economies develop, as nations become developed, we are able to control infectious diseases through providing safe water, safe food, vaccinations. And what emerges are lifestyle diseases. And lifestyle diseases are caused by the way we live. What we consume tobacco, we use alcohol, our dietary preferences and practices, how physically active. See, poor economies are physically very active. And as we become wealthy, we just have to say, Alexa, do this, and the TV gets on, the water heater gets on. And so we become more and more sedentary. Some of our sexual practices and some infections and inflammations cause a whole lot of what we call lifestyle diseases. That includes cancer. But more than cancer, there is heart disease, there is diabetes, there is hypertension, there is cerebrovascular disease, there is COPD, lung diseases, and what I mentioned about tobacco, alcohol, dietary practice and preferences, inadequate physical exercise, they are common factors, common causes for all these lifestyle diseases, including cancer. So when you want to prevent cancer, you must refrain from using tobacco. You must not consume alcohol. You must eat well and eat wisely. You must exercise regularly. And some infections and inflammations have to be handled promptly. If we do this in India, we can prevent 50, 60, 70% of cancers. But along with preventing cancers, we also will be able to prevent heart disease. Why do you get a heart attack? Tobacco, alcohol, dietary practice, exercise, lack of exercise. Why do you get a stroke? Stroke is nothing but blood vessels in the brain get blocked or blood vessels in the brain rupture. Tobacco, alcohol, dietary practices, inadequate physical exercise. Diabetes, hypertension, many causes, many reasons. Many times we don't know the reasons for diabetes, but of all that we know, tobacco, alcohol, dietary practice. So like that, if you look at several non-communicable, the same factors. So when we prevent cancer, we actually prevent a whole lot of non-communicable diseases. In other words, we end up promoting health in the community. And like I tell every time, health promotion is a national responsibility. If you want your country to be strong and prosperous, you want all your citizens to be healthy. Only then will our GDP grow up. Only then will our nation be protected from, people who wish us ill. And that is a national responsibility. Health promotion is not the government's prerogative alone. It is every one of us in society. Ultimately, in democracy, we are the government. We elect the government. Government is by us. Right? And so we owe our country, our countrymen, and at another level, the whole globe, we owe ourselves to be healthy.
Health promotion is national responsibility.
Yes.
It's so powerful. And if we take care of ourselves, then we are promoting the GDP. So that's such a powerful one. And health promotion is not only government's responsibility, it's our individual responsibility. So, as a leadership coach, I want to ask you, what is that individual leadership which everyone needs to follow to bring this success to themselves?
So I think each of us has leadership in us. And each of us has opportunities to lead from wherever we are, whether we are designated as director or superintendent or leader or commander, but we can all lead from wherever we are, from the Masi at home to the topmost person in the organization. Everybody has in their own spheres of every one of us has a sphere of influence. As a parent, as a sibling, as a friend, as a student, everywhere we have opportunities to influence people around us. And I think leadership begins there. We have to promote, we have to support the causes that are worthy of furthering our civilization. We have to support, promote education, health, poverty eradication, environment, so many things, today. And all of us are in a position to influence these choices. And I think Individual responsibility, taking responsibility, one's own actions is probably one of the most important things to be able to take ownership for what happens around us is a very important tenet of being a leader.
Ownership is the key. So
I have to take ownership for what I end up doing. I mean, I cannot be a passive observer for everything. If I don't have the courage to stand up and be counted, then I have failed, the opportunity given to me as a human being.
So challenge when you see things which is
Not okay.
not working, not okay. And what I also understand is you have to start with yourself.
When you cannot control your own self, how are you going to control others?
Exactly. So manage yourself, control yourself. So, what I understand is you have to eat right, you have to exercise, and
make the right kind of choices in how you live.
how you
Don't use tobacco. Don't use alcohol. Eat healthy. Exercise regularly.
So people say that one wine is good for health.
No. That is
one
not correct.
whiskey, it's not.
That is not correct at all. No alcohol is good. No amount of alcohol is.
Okay. Yeah, because that's what I think. Taking alcohol has become so common nowadays. Earlier days, people used to, when someone will come to their home, they would give tea or coffee. But it is more
So, both tobacco and alcohol are social problems, are cultural problems, are economic problems. And so, depending on who is arguing for which side of the game, people will argue for, tobacco or alcohol brings revenue. Alcohol especially brings tourists. And so there are many reasons to support promoting use of alcohol. Alcohol, especially more than tobacco. Tobacco, people will say smoking others are harm. You spit on the road. So it is easier to talk against tobacco. It is more difficult to talk against alcohol. But the truth is, both of them cause irreparable harm to our civilization, irreparable harm to our society. And we look behind our own vested interests in promoting the use of alcohol and tobacco. Short-term gains, if we can put aside that, we will do our country a big favor, by reducing use of alcohol and by completely banning use of tobacco.
Doctor, I've been a social drinker. Social drinker, I mean, yeah, when there are parties and all, I'll drink a little bit here and there. But since I've been working with you, I also thought that I'll stop drinking. So I have really, most of the places I sit with a very nice glass in which I will put some water and some ice, and then I will act as if I'm drinking. And then if someone asks, I do say that, I have migraine, which is a fact. I started having migraine and was not able to take it, but I will say that I'm not able to take because I'm not able to take. So that way I'm like quitting.
No, that is not correct.
No.
You have to take a stand. You have to say you're quitting because it's not healthy. That is how you will drive home the point. By being diplomatic, you're not sending out any message.
Sure. Okay. Right. So I have to say that I'm leaving because alcohol is not right.
Correct. It's a statement that you will make. You have to stand your ground. You have to stand up and be counted. I don't want to take alcohol because one of the reasons why people consume alcohol is peer group influence. And now you have to de-influence. You have to go the reverse influence.
Yeah.
So you have to take up and tell them that. Right. What is the point in having and pretending you have a glass of white wine?
White wine. Yeah, many does it. So I do a lot of work with the corporate. I have a lot of clients who are in the corporates, and they say that in order to go to parties and mix and all, if I say I don't drink, people look at me
loud and clear. It's not healthy.
It's not healthy, huh? Because not as much in India, but when I was in England and other places, there even after the training programs, there will be parties. and it was like an alcohol party as well.
So you know what? Let me tell you something more. Alcohol or tobacco or diet, they cause NCD, several NCDs. And when you see a patient with cancer, it is not at all uncommon to see them have diabetes or hypertension or cirrhosis or other diseases caused by the same etiological factors. This morning, we were seeing a report.
Right.
Somebody had an esophageal cancer. He was an alcohol consumer. He used to smoke and he has cirrhosis of liver. He has a lung problem. And now his treatment for the cancer is complicated by other things that have happened because of alcohol and tobacco. And so and that's a 51-year-old man. It's a tragic situation. It's a needless and preventable problem. That family will go through hell now.
I think I will drive that message now loud and clear, and I hope my audience who are also listening will get impacted with that. And this case which we are talking about was actually a live case we were discussing today. So I remember, I know that you go to interior villages and all that. So what are those unique cases where you have really seen how families get affected? Because I know you mentioned about family.
See, one of the key things about our hospital is we are very deeply rooted in the community. And many of my colleagues spend days and days and days in the community, talking to women, talking to working folk, talking to self-help groups, talking to villagers, helping the government health machinery, the ASHA, go and administer their questionnaires, go and create awareness in order to A, promote healthy lifestyles, B, promote awareness about cancer and other diseases. 3, promote early detection if there is a problem. See, as a country, we are 1.4 billion population. And out of that, screen eligible will be at least 400, 500 million people. And we don't have the resources to screen all of them. And even if we screen them, we don't have the resources to treat all the people who come up with problems. Yeah. And so for us, it makes enormous sense to promote early detection. And so if you look at somebody, a woman who comes with in the cancer hospital, often we have women who come with breast cancer, which are 10, 12 centimeters in size. Often they have fungated out. There are maggots in them. And breast is an organ the woman feels every day when she's bathing. Even a 1 centimeter lump will slip under the hands when she's soaping her breast. And so breast cancer can be easily diagnosed when it is 1 or 2 centimeters. If the woman has to come and see a doctor. If you treat a 10 centimeter size tumor, out of 100 women, not even 40 will live for 10 years. If you treat a 2 centimeter size tumor, out of 100, 80 will live for 10 years. And so that is the power of early, and that will save lives, that will save families. Breast cancer often occurs when the woman is in her 40s and 50s. That's a time when the family has formed, the kids have grown, probably 10, 12-year-old daughter who's not yet established her periods, probably a son who is going into college. He's facing problems like alcohol and drugs and smoking, peer pressures in the community. That's a time when the parents are needed at the house. Imagine father is a smoker or alcoholic and develops a lung cancer or esophageal cancer. A mother has a breast cancer, which is, a stage 4 breast cancer. Imagine when one of the parents leaves, then, the girl needs the mother when she's 12, 13, 14, 15. Very essential. The boy needs the father, boy needs the mother. And at that time, if one of the parents is snatched away, It is tragic. And then often because of the condition we are in, we are all joint families. There will be elderly parents depending on them. There will be siblings depending on them. We are all extended families, and so many lives will be impacted upon because of a cancer or a heart attack or a stroke. And these are preventable problems. These are problems that drive us into poverty, that drive us into despair, that drive us into more misery. And remember, when an individual develops a cancer, we did a quick survey some time ago in the hospital. We looked at oral cancers. Out of 100 people with oral cancer that we treated, nearly 80 people never went back to productive occupation. And so, if somebody develops cancer in the family, especially amongst the middle class or lower middle class or poor people, they will lose a lot of their property, if not all. They will take loans. And so the parents' generation is gone. What happens? Somebody has to earn. So the kids will drop out of school, even though education is free in many parts of the country. The kids will still drop out of school because they have to earn. Somebody has to earn. No? So the son or the daughter will go to, and so they will miss out on education. Their generation is the third generation that will start recovering. And so we've lost several generations of people from occupation, from education, because of a health problem in one index individual. So we are actually harming our family, and we are also harming our community and nation in the larger perspective.
So one change, if one person can make, one stand can one person make.
All of us have the opportunity to make these statements in public. All of us have the ability to change events in the country. And by not talking about health, by not promoting health, by not talking about our lifestyles, we are actually not supporting the country's progress. And I think this is every one of us has the ability, has the opportunity, and has the power to speak up for it.
There is a question. There are a few questions which has come from friends, and so I want to ask you that. So one of the first question is: healthcare has become so commercialized and city-centric. What must healthcare do to reach the masses who cannot afford high-cost healthcare?
See, my professor, Dr. Krishnamurthy, used to say, see, the fruits of science must reach the last man in the queue. And the science that does not serve everybody, that science is worthless. And I think it is very, very important that all the progress that happens around us, be it in healthcare, be it in education, everything must reach out to everybody in the community. That nobody must be excluded from accessing good quality healthcare. Yes, today we are city-centric. Yes, today a lot of healthcare is in urban localities. But as a nation, we are trying to change it. We want to make sure that there are more healthcare facilities in far-flung rural areas. That the healthcare that is available, it is not enough that we just have healthcare. Healthcare has to be of good quality. It must be evidence-based. It must be standard of care. It must be affordable. It must be accepted by the community. It must be provided in a culturally relevant way. And so these are all. We are in times where all of this is happening. It will take us time. Nothing will happen overnight. But in order to make everybody, have access to healthcare, we have to make sure that we provide healthcare, cancer care, cardiac care, whatever, close to people's home. We have to decentralize, this whole healthcare system. And I am pretty sure it will happen with time. All of us have to be party to it. Doctors, nurses, hospital managers, government, everybody is part of this transition. And if all of us play our part, we will make it happen.
I know about the satellite centers which CCHRC started, and also I remember that I was one of the tours. I went deep inside the village to help someone. Tell me more about it. How do you do
So the way we are trying to structure the healthcare delivery from our hospital is we are looking at, see, we looked at the area from which we have patients in the Barak Valley, from Dima Hasao, from the state of Tripura, from the western part of Manipur, from the northern parts of Mizoram. So our idea is to make sure we have three, currently we are thinking three, but this might change, three hospitals in each of these areas. One is in Cachar, we are putting up one in Dharmanagar. We're looking at one in either Tamenglong or Churchanpur, somewhere in western part of Manipur. And each of these hospitals is then surrounded by daycare clinics where we should be able to. So the hospitals will provide everything that is needed under the sun for cancer care. And each of these daycare clinics around the hospitals will provide early diagnosis, will provide palliative care, will provide for chemotherapy, probably simpler surgeries, whole lot of diagnostics. A lot of activities can happen in the satellite clinics, which are closer to people in their villages. They don't have to travel all the way to the hospital every time. And each of these satellite centers will then be served by PEP centers, PEP, Prevention, Early Detection, Palliative Care Centers, which are essentially one-man facilities. One person on a two-wheeler will go around the community promoting health, talking about lifestyle, organizing screening camps, organizing awareness camps, going to the homes to provide palliative care, providing after surgery care. Sutures have to be removed, dressings have to be done. So the idea is, so in my father's village, the doctor, this was many years ago, used to have a briefcase and go home to home to home delivering care. He would have coffee, he would chat with the family, and he would also be the doctor. And then he would attend wedding. Unfortunately, today you cannot take CT scans and radiation machines to people's homes. But you can still decentralize a lot of care to reduce the burden of travel, to reduce, many of them are daily wage earners. If they have to travel 4 hours to a city hospital, they will lose that day's earnings, probably the next day's earnings as well. And so to reduce loss of wages, to reduce impoverishment, we have to be able to decentralize care and take a lot of this close to people's homes. That is how we will transform the way healthcare is provided in the community.
That's a great plan, and I know you've been working on this for quite some time. During pandemic, while working with you, we did this EQ workshops, emotional intelligence workshop. So, how important is emotional intelligence for doctors?
Very important. Very, very, very important. I remember we had a conversation some time ago where you said emotional quotient is like a bank balance. And every time there is an emotional need, you dip into it and take it and deliver whatever has to be done with your colleagues, with patients, with caregivers. And then you have to keep refilling it. Otherwise, what will happen is that bank will go bankrupt and you will. So it is so true, because healthcare is a, whatever you may say, it is a emotionally demanding and draining profession. So yesterday, let me tell you a story. I have this patient who we operated on 3 years ago. Very, very scared, very, very fearful. Unfortunately, she came back with recurrent cancer. And then the cancer grew and grew and grew. But she never lost her faith in the hospital, never lost her faith in us as doctors. Every now and then she would come, she would cry, we would have to console her, she would be fearful. She has a daughter who's taking class 12. She has a son who's finishing graduation. Her husband is a principal of a school. And a whole lot of complex emotional issues. And she will hold on to my hands and cry. And it would, I would have to draw on all my reserves. And then at the end of that, she was getting admitted, she will say, will you come and see me again in the night? So, and the last thing once the day's work is over, sometimes you would be drained and you have to push yourself to go and meet her because you promised you will go and see her. Yesterday, she came, and at the end of our conversation in the OPD, she waved bye. Okay, and she's dying. And she has sort of gotten around to the fact that she is dying. We've had several conversations. And she said bye in a way, of taking leave of me, that you've taken care of me. But she was getting admitted for a blood transfusion. So I went to see her in her room, and she was thrilled to see me. And then she brought out a shirt. She was dying, and she gives me a shirt. How do I respond to it? So I take it and keep it, and then she tells me, I'm going home, I may not see you again. And we have a conversation about dying, about afterlife, about meeting in God's kingdom on the other side at some point of time, about not forgetting her. Doctor, आप मुझे भूल जाओगे क्या? नहीं भूलूंगा, नहीं. And but she did not cry even once yesterday. Earlier, every meeting she would cry, and yesterday, and then before I die, will you be able to come and see me at home once? Will you have a meal with me at home? I promised her I will. And so now when I go back, my first job Saturday morning is to go to her house. So to be able to, it is, on one hand, it is a very rewarding and enriching human experience, to be a part of so many people's lives so intimately. Unless you actually experience it, you will not realize the fulfillment that it brings us. On the other hand, it is also very, very, it needs to be frequently charged and recharged and recharged. And imagine if it is for a doctor like me, if it is such a big, imagine what happens with nurses who spend all the time with patients. Imagine the amount of emotional reserves they will need. And emotional, to be emotionally strong, to have a reserve of, how do I put it, emotional strength that you can distribute to patients. This is something that can be learned. This is something that can be taught. It does not have to be, all of us are not born with these, traits. These can, by understanding the need for it, by practicing it, by being mindful of the need to be emotionally strong, emotional surplus, to be compassionate. These things can be learned. And I think it is very important that as human beings, we learn to build our emotional reserves. It is even more important in some professions, in the medical profession, in teachers, to build a surplus of it.
Only when you are full when your bank account is full of happiness
you must actually love or learn to love your fellow human beings. You must learn to love life around you, and that is not a difficult thing to learn.
But we are never trained to do that, I think,
because we are hesitant of demonstrating love. We are hesitant. We think we will become vulnerable if we demonstrate love. If my child grows up with criticism, if my child grows up with punishment at every, imagine the kind of emotional stock he or she will have. If my child grows up with open display of emotions all the time, if my child grows up with praise and encouragement being showered all the time, if my child grows up seeing support given every time he or she feels, imagine the emotional balance he or she will have. I think like taking a stand on socially relevant things, demonstrating or taking a stand to love your fellow human beings is also it's a human responsibility.
We really don't display love because we feel we will be vulnerable.
Yeah.
It's a part of me.
Yeah.
But
It is okay to be vulnerable.
exactly.
Yeah, somebody may make fun of you. It's okay to be made fun of. Somebody may reject it. It's okay to be rejected. It's all right. So long as in your mind there is clarity, if your intentions are straight, I think to reach out to people is perfectly okay. To ask for support or to ask if the other person is feeling well, to offer to stand by is perfectly okay. Even if somebody were to reject you, it's okay. Your intentions are to demonstrate support. Your intentions are to express love. And love is such a powerful emotion that even animals express it, and we are evolved animals. And if we don't learn to express our love, our caring, we will miss out on a very vital part of human experience. And it is love that makes the world go around. And promoting goodwill, promoting compassion, promoting love, promoting care is a very deep human responsibility. And it leaves the person who receives love fulfilled, but it leaves the person who demonstrates, who expresses, who gives the love even more fulfilled. Both parties will become more enriched because of that interaction.
So once again, thank you so much, Doctor, for being here.
Thank you for inviting me.